So, you added a memory. Is that correct?
Technically, we only use pre-existing ones.
And layered them. Miss Ellen, can you please explain what happens to a patient when their manufactured memories clash with the truth?
Then they exhibit signs of confusion.
You mean your lies eventually collide with the truth and their made-up narratives crack?
It's unlikely to crack if the new memories are close enough to the patient's original recollection.
But what could make it crack? Say if something contradicts the manufactured memory and maybe an evident object or memento of sorts, or a souvenir.
Possibly.
Or a family member or a loved one contradicting the false narrative. Maybe?
Maybe.
And if these contradictions persist,
A sort of cognitive dissonance.
which leads to pressure on the mind. And what could that lead to?
Hypothetically,
No, realistically.
to certain forms of identity disorders.
Exactly. Just like you've seen with your own eyes. Your Honor, Sergeant Wilson's exact symptoms. Patients can lose themselves in memories that aren't their own, forget things that have happened, and remember things that haven't. In other words, they lose their minds. And that is exactly what happened to Sergeant Wilson. While under your care, that's exactly why he assaulted you, for failing him as his therapist and leading him to repeat violent tendencies. And that is what is at stake for the innumerable patients that would come to Memo for help and lead as victims in a worse state than they arrived in. Miss Allen, you mess with your patient's memories to the point of making him insane. And the state of New York will not allow you nor memory-altering technologies to continue erasing truths and manufacturing lies under the guise of therapy.